Good afternoon. David Sweat, Deputy Director, Shelby County Health Department. I'd like to welcome you to the May 6th City of Memphis, Shelby County Joint COVID Task Force press briefing, and we'll jump straight into the numbers. So today in Shelby County, we've had 96,221 cases reported so far in the pandemic. That is an increase of 171 cases yesterday. We've had 7,328 cases reported from Tipton County in Tennessee. We've had 5,040 cases from Fayette County, Tennessee, 21,474 cases from DeSoto County in Mississippi, and 5,665 cases reported from Crittenden County in Arkansas. If you add that all up, that's 135,728 people in the five-county area that have been diagnosed with COVID-19 disease in the last 14 months. As far as our deaths, we're at 1,628 reported deaths in Shelby County. It's an increase of 5 yesterday. We've had 319,225 people in the analysis from yesterday that have been vaccinated, and that includes 92,883 people who have received at least one dose of a 2-dose series, and 226,342 people who have been fully vaccinated either with both doses of a 2-dose series or they've received Johnson & Johnson vaccine. I have a couple of slides I want to show you about the vaccine data, if we could pull those up, please. So this level of vaccination brings us to 45.6% of our campaign goal of 700,000 people vaccinated in Shelby County. And next slide, please. And what we know right now is that more than 71% of the people over 65 years of age have been vaccinated. Almost 56% of the people who are between 55 and 64% in Shelby County have been vaccinated. And then going down to the low end, we're almost at 20% of the folks between 16 and 24 years old have been vaccinated. So that's 1 in 5. So we want to say thank you to all the folks who have come out in all the different age groups and in all the different parts of Shelby County for coming out and being part of the effort to get us back to normal by getting vaccinated. And one more slide, please. And what you can see here is the distribution of the penetration of the vaccine. And you can see up and down the Poplar Avenue corridor and in the medical district, that's where we have the highest proportion of people who have been vaccinated. And generally speaking, on the eastern side of the county, we've had more folks get vaccinated than in the west. But we've actually got a lot of progress to be seen in this map, because we used to have 9 zip codes that were in the lowest level of vaccine uptake. And we're down to 3 now. And that's 38127, 38118, and 38125, I think, or I'm not sure what that is right above the 3841141. But those areas are the least penetrated by vaccine now. But that means that 6 different zip codes that used to be in that lowest tier have moved up and have taken up the vaccine more in the last week than what we had been seeing previously. So once again, I want to say thank you to everyone who has participated in the vaccine campaign and effort, because we are in the best place we have ever been in this pandemic so far. 14 months ago, almost 1 million people in Shelby County, right, were susceptible to this virus and at risk to be infected. That number is now down to just over 300,000 people are susceptible to infection, at risk to get infected. And that's the smallest number it has ever been. And it's because of y'all coming out and getting vaccinated, plus, unfortunately, those of us who have become ill, that's where they get their immunity. But together, that's 2 out of every 3 people in Shelby County. Now, there's still opportunities for you to get vaccinated, but it's also opportunities for you to be tested. And I want to bring a couple of events to your awareness. Today, at New Growth in Christ Christian Church at 7550 East Shelby Drive, we're offering testing, but also vaccine at that location until 1 p.m. So you still have time to get there. we're offering both Johnson & Johnson and Moderna vaccine in that location. You can also be tested. Then on Sunday, May 23rd, we'll have another vaccination outreach in cooperation with Boutron Media at 4350 Stage Road in Memphis, 38128. That's up in the Raleigh area. And that is not a testing event, it's just for vaccination, but there we will have Pfizer first and second doses and Johnson & Johnson vaccine available. So once again, thank you for all of you who have been vaccinated, and for more about the progress we're making, bring Doug McGowen to the podium.
Thank you, David. Good to be with you all today. As David mentioned, we're making good progress on the vaccine campaign, but there is still more work to do. So far, we have delivered 545,000 vaccinations here to people that live in Shelby County, a few more when you count folks who are from outside the county. There have been some questions based on the timeline of the vaccine for the public pods, and I just want to address those up front. I have told you over the last few weeks that the Community Vaccination Center at the Pipkin building will no longer be a community vaccination site after about the 19th of May. That does not mean that the Pipkin building will still not be available for vaccination. That just means that the DOD, the Department of Defense, and FEMA team that is there, they will remobilize or demobilize that site and go back to their home bases. But Pipkin will remain, for the foreseeable future, a vaccination site. For people getting their vaccine now, they may be wondering, well, when and where can I get my second dose in either 21 or 28 days? We will retain public vaccination capability in some shape or form in Shelby County until such time as it is deemed by the state that we do not need to do that. As we have done before, we may shift some locations, we may close locations, but we will retain that, and the information will always be available on the COVID-19 website. So I don't want people to fear that simply because we're demobilizing the federal portion of the Pipkin site that we will not have capacity to serve you. Additionally, there are many new resources out there like VaxFinder that can help you find a vaccine nearby, especially through some of the especially through some of the private providers like Kroger's, Walgreens, CVS, and some of the private pharmacies and outpatient clinics. So feel free to take advantage of that as well. Now, we're anxiously awaiting approval in the coming days. I don't have a date yet for when the age of eligibility will move down to 12 years old and above. The exciting part about that is that that adds about another 50,000 eligible people to be vaccinated. And we're going to encourage parents and grandparents and caregivers and guardians to have your young people vaccinated. Just like you do for a number of other diseases, it's important to get your children vaccinated because they are just as susceptible as anyone else. They may not get as sick, but they are susceptible to contracting the disease and to transferring it to other individuals. Now, we've done about 34% of the overall population, as David said, has received a vaccination, but almost 45% of the total eligible population, which is really good progress. And as David mentioned, about 24% of the population has antibodies that could be attributed to an infection. Now, there's some overlap between people who've been infected and people who've been vaccinated, but when taken together, as was just mentioned, there are still a little more than 30% of the population that is susceptible to the virus. When we talked Tuesday, I set a goal of doing another 80,000 individuals over the next 4 to 6 weeks. If we do that, it will push the number of susceptible people in Shelby County to 20% or less. And that is really where we would like to be as we move into the summer months. So the work before us is clear. We will retain the capability and capacity to vaccinate a very high number of people, but we're really trying to get at least another 80,000 over the next 4 weeks so that we can get down to that 20% of people who are susceptible, meaning that 80% of the people have some level of immunity to the disease. Last thing that I'll update is on the sweepstakes. As you know, we're Very excited to be able to offer a brand-new car to people who register who have been vaccinated. There have been some questions, so I want to just clear up any confusion. Anyone who is a resident of Shelby County who is 18 years or older, who has already received a vaccination, whether 1 or 2, or who will receive a vaccination before May 31st, is eligible to enter the sweepstakes. So there are some folks that believe if I already had my vaccination, I'm not eligible. That is not true. If you're in Shelby County, 18 years or older, and you've already received a vaccine, or you will receive a vaccine before May 31st, you're eligible to enter the sweepstakes. So with that, you'll see the website that is being displayed there. That's how you get information about that. You can also go to covid19.memphistn.gov to find information about where you can get your vaccination, whether you choose to have an appointment or whether you choose just to show up at one of our locations that doesn't require an appointment. And finally, you can call 222-SHOT. They will take care of scheduling an appointment for you, and they will also, if you choose to register for the sweepstakes that way, take your registration over the phone. So with that, I'll stop and take any questions that you might have.
Kelly Roberts, WMC.
Hi there. I didn't know if anyone is there from the Shelby County Health Department who could talk about the first public meeting of the reestablished Shelby County Board of Health and what was discussed there on Tuesday. Are you all comfortable in saying that the new health directive will do away with mandates and move to the recommendations?
So thank you for the question. As far as what was discussed in that meeting, basically it was an opportunity for the Public Health Advisory Board to give us their feedback and opinion about a variety of things that might be included in the next updated health directive. Continue to solicit input from other folks right now. And that wording of the health directive is still being written. It'll be available for us to share with the public on the 12th of May next week, and it go into effect on the 15th of May. But in terms of telling you the exact wording of phrases and clauses and things, I'm at this point, because it's still in development, I can't do that. But be watching next week to get the details as it's released, and then we'll be able to address questions about that at that time.
Thank you. And David, while you're up there, a tweet from Governor Lee yesterday said something about how we'd love to see indoor and outdoor sporting events at full capacity. Just from medical point of view, what do we think about full capacity of sporting events outside and definitely indoors even here in Shelby County at this point?
Yeah, so as far as outdoor events, the Centers for Disease Control guidance is pretty clear that there's very low risk associated with transmission outdoor unless it is a crowd. And as far as indoor, there's certain other recommendations from the CDC about what we should do when we're indoors with folks. And it's a mixed crowd where some are vaccinated, some are not, or it's a crowded setting. In all those situations, masks are continuing to be recommended. Whatever the exact wording of the health directive will be, our guidance is always going to anchor onto the recommendations of public health experts at the Centers for Disease Control or other key agencies and organizations. So we'll continue to recommend that, and then whether it's the FedEx Forum or the Orpheum or the GPAC or any other place, what we'll be encouraging them to do is to study the recommendations and suggestions in the guidance that'll come out next week, and then they'll have to make their decisions.
Jane Roberts, Daily Memphian.
Well, since we are all expecting the childhood vaccination will be approved for use perhaps early next week, can you say if Shelby County would then immediately begin vaccinating children? And I have a follow-up.
Yeah, I'm certain that Doug McGowen would like to speak to that, but I will say this, because I promised y'all this last week, or Tuesday. We did look at the data about what's going on with the proportion of cases that are pediatric cases. And in the pandemic overall, it's been about 11.9% of the cases diagnosed have been pediatric cases, or those less than 18 years old. But in the last 30 days, it's been more than 18. It's like 18.8%. So we are approaching a proportion of 1 out of every 5 cases being a pediatric case. That doesn't mean that pediatric cases are increasing. What it does mean is that the proportion of cases detected that are pediatric is increasing, and that's related to they so far have not been able to be vaccinated, and therefore they're still susceptible. So I will invite Doug to come and answer the rest of the question.
It's a great question, Jane, and the answer is yes. At the earliest opportunity, once we receive approval, we won't pivot midday if it comes midday, but the very next day that we're able to, we will offer vaccines to those 12 and up. Obviously, they will need to have a parent or a guardian with them who can sign the consent form, but we are prepared to begin that as soon as we have authority to do so.
My follow-up question is completely unrelated to this, but I'm wondering if you can give us a little detail about the sweepstakes. Did the city of Memphis buy the car, or will buy the car, or was it donated?
No, I mentioned the other day that the business community came together and said we think that we could help drive the vaccine campaign, and made very generous contributions from a number of business partners. It's being administered through the Memphis Brand Initiative, so the city of Memphis is not contributing any money to the money that was collected for the purchase of the vehicle to be given away through the sweepstakes.
Catherine Burgess, Commercial Appeal.
Hi, I'm wondering, a report recently came out saying it's unlikely that the United States will reach herd immunity. And I'm wondering, how likely do you think we are to reach the vaccination goal here in Shelby County?
Well, I'll let David talk about the herd immunity and the vaccination goal. It is my intent to retain the capacity for us to have enough vaccinations until we reach herd immunity. And that is going to be through a number of our private providers, public vaccinations, and other sites. And as David was just talking about, immunity has several parts. It's people who've received and have antibodies through vaccination, and others who have some immunity through illness. But we are coming close to the point where we will be able to say that we've reached a pretty good level of immunity. Our vaccination goal did not really contemplate the immunity from illness when we set that early on, but I'll let David comment about that. The bottom line is that we have enough vaccine here in Memphis and Shelby County, irrespective of people's immunity through disease, to vaccinate 700,000 people or more if people would come out and take advantage of the vaccine. So, David?
Thank you for the question. Well, okay, so let's just get philosophical for a second. Epidemics end. They do eventually end, but they end for biological reasons. And will we get to herd immunity, or will we get to the point, because let's really say what we're talking about here. We will reach herd immunity when the virus no longer finds it easy to infect new people. And that means that there's just not enough new susceptible people left that can sustain the transmission of the virus. So whenever we reach that point, the epidemic will end. It'll crash. So yes, we will get to herd immunity. The question isn't whether we will or won't. The question is, how soon will we get there, and how much in control of that are we going to be? So we can be more in control of that, and we can end it faster if more people would come out and get vaccinated, because then we can more rapidly shrink the pool of susceptible people to a small enough number and have them be dispersed enough throughout the population that it's hard for that virus to find the next person. in the chain. And so, you know, to answer the question, yes, eventually it'll happen. The question is how much suffering through disease and death has to occur before that happens, or how fast can we get there through vaccination and avoid that suffering and death?
My next question, you mentioned that you've had six zip codes move out of the lowest tier for vaccine uptake. I was wondering if there were any particular things that were done that you might attribute that to that helped with moving them out of those lowest tiers.
Yeah, absolutely, and I'm sure Doug wants to talk about that as well. But one of the things that we've done over the last several weeks is every week we've shared with the city of Memphis analysis of the geographic distribution as well as the demographic distribution of vaccine uptake. And in those zip code areas that had the lowest level of penetration or uptake, the city has then pivoted and responded in a variety of ways to send pop-up vaccination efforts out into those communities and try to address that. So I'll invite Doug to speak to that.
So that's exactly right, David, and the question is a good one. It's intentionality. We have an entire team on the vaccine, with our vaccine group, that does nothing but look at the data, partner with organizations who are willing to host a community-based pod, and then organize that pod and go deliver vaccines in that community. That's a holistic approach. It has communication around it. It has grassroots recruitment for individuals, and we have done, I think, more than 30 of these now with neighborhood churches and organizations. They have varied in the level of turnout, but every single one counts. We've had pods that we've been there for all day and gotten 40 people vaccinated, and other pods where we've had 1,200 people vaccinated. We also have what we call the vaccine machine, which is a mobile vaccination unit that can take vaccine anywhere. It's basically a self-contained point of delivery, if you will. Comes with a couple of paramedics, and all we need is some volunteers to come out and help organize. And we are doing homeless, homebound, and other small groups of individuals. We had the vaccine machine out at the Cinco de Mayo event. So it's very intentional. We have 7 fixed sites, as you know, but not everybody can take advantage of those for a variety of reasons. And so we have really been earnest in our desire to follow the data and to provide opportunities for people in those zip codes to take advantage of the vaccine.
Hannah Grabenstein, MLK 50.
Good afternoon. I am curious about looking at the vaccination numbers or percentages by age group that you showed a little bit earlier in the press conference. I think I saw that just about 30% of 65 plus in the highest 2 age categories still haven't been vaccinated, the groups that have been eligible for the longest. And I'm wondering, do you know who those people are? Do you know how to reach out to those people and try and get them vaccinated? Are they maybe just people that are unlikely to be vaccinated?
Well, David can probably speak to the epidemiological reasons why people may not want to, but we do know from some of the survey data that there are, nearly 20% of people who just are not going to do it. Could be as low as 10 to up to 20 in some parts of the population. But then there's other people who are just deciding to wait, and they think it's going to be available later on. We know people are just in general can procrastinate, especially when you have a lot of vaccine available. There doesn't seem to be a sense of urgency. So as to the specific individuals, I can't speak to whether we know those individuals by name. We are certainly not attempting to do that. We just know the age of the individuals by population that comes from the census data, so we know that we have reached about 70% of people in that bracket. So David, do you want to talk any more about that?
Yeah, thank you for the question. So in terms of, are we ever going to get to 100%? Probably not. I mean, we don't even get to 100%, unfortunately, with things like measles vaccination, which is required and institutionally, established going back to the 1960s, right? But We are at 71.5% of people above 65 have been vaccinated. We have done some analysis by different age stratifications to try to identify, even at that oldest age group, where the under-vaccination is occurring. We've shared that information with the city for planning purposes, and we'll continue to outreach. Now, we know that some of those folks are homebound, and so partnerships with folks like Meriton or other outreaches to basically take the vaccine to somebody who can't leave their house, that's an important part of the effort going forward. But in every campaign, it's kind of true that you spend about 20% of your effort getting about 80% accomplished. But then you spend 80% of your effort on the last 20%. And so as you may have seen, and you've certainly heard, that we talked about the demobilizing of the DOD facility, or at least their operation of it at the Pipkin building. The era of mass vaccination sites will eventually come to a close. And then our challenge will be to get the rest, the folks that are just not able to avail themselves or don't want to avail themselves of those mass sites. And then we'll, as a community and as a leadership group, we'll pivot once again and develop new strategies and tactics to help us reach the rest.
Thank you. That's actually a great segue into my second question, which is, Doug, you mentioned earlier that the community sites are remaining open until such time is deemed that they are no longer necessary. And I'm wondering, do you have thresholds? Is it, X number of people come out a day, and that means that the sites are not, not worth keeping open, but maybe aren't as fruitful anymore?
We don't have any firm thresholds. It's a continuing discussion about where does the return on investment come, and I don't mean that in financial terms. I just mean it's a heck of a lot of manpower for a little bit of return. So we continue to discuss that on a daily basis, just as we did when we made, as David said, some pivots early on. We changed times when we were open. We've closed for several days. We've expanded the hours. So we will treat the actual availability of those public sites in the very same way. We will look for any redundancies. We'll look for areas where we are seeing very low turnout. And so when we see very low turnout for an extended period, that's probably an indication that that site may have reached its useful life. So I don't have anything that would be a firm deadline or a firm schedule. We are still of the belief that there are more than 100,000 people out there, or 200,000 people, who would still like to get the vaccine. That's a lot of folks. So we need a lot of capacity to do that, and we encourage everybody to take us up on that while we still have this wonderful capacity available to everyone.
Alex Coleman, WREG.
Hey there, Doug. Can you hear me?
Yes, sir.
I was wondering, I heard Mayor Lee Harris mention, of course, a couple of days ago that maybe some ambassadors like nurses, teachers, and many others in the community will soon be hitting the streets to kind of really help this campaign effort regarding vaccinations. Any updates on that program and how soon we might actually see some of these people going into some of the communities?
Sure, I'll let David talk if he has any more details about the time, but it certainly is a wonderful idea and a wonderful group of individuals who are volunteering their time to be a street team to get out. As we've said time and again, the message is important, the messenger is important as the message. And so having folks out there, much like a Get Out the Vote campaign, if we treat this in the like manner, you'll have phone banks, you'll have people doing door knocks, and we really do want to, as a part of this last push, there's only so much that TV and radio and newspaper and social media can do. We really do have to hit the streets, and that's what David was talking about. That's a heavy lift, but the organization through the mayor's office to get this COVID community team together is one that we think will get us across that last mile. David, do you have any other updates?
Yeah, thank you for the question, and thank you, Doug. Yes, in terms of the specifics of that effort, I don't have those details, but what I do know is yesterday I was sent some frequently asked questions, talking points to edit and review, and I did that for them, so they were gonna print up pamphlets that they intend to take out door to door and share with folks on the street to try to answer people's questions and concerns. But I think what I want to close with today, as we're running out of time, is just, let's just take a moment and think about what all we have achieved. 14 months ago, we had a brand new virus land in our community that we were all susceptible to and posed a risk to us that we had to drop what we were doing, because we were all busy, and come up with a response and come together as a community to respond. And what we're discussing right now is just one more example of what Shelby County has done and continues to do, is come together to achieve something really remarkable in our lifetimes. How many times have we all worked together as hard as we have worked over the past 14 months to achieve any single goal? And so proud of the Joint Task Force, thankful for the collaboration of all the political leadership, all the partner organizations that have been so diligent in staying with it for 14 months, and grateful for the partnership with the city of Memphis from the county side. So together, what have we done? Well, what we have done is gotten to the point where over 500,000 doses of vaccine have been administered. 14 months ago, we didn't even have a vaccine at all. And we've gotten to the point where 2 out of every 3 people in Shelby County are no longer as at risk for getting infected as they were 14 months ago. We've managed to preserve the capability of the hospitals. We've managed to slow the spread until the vaccine arrived, and then we've managed to put in an infrastructure together to deliver that vaccine that's pretty robust. Also, one thing that we did a year ago is we created an infrastructure for testing. And that testing infrastructure has been abandoned in many communities, but it's been maintained in Shelby County. So we still have 16,000 plus community-supported test opportunities if somebody needs to get tested. And our laboratories and the University of Tennessee Health Science Center have collaborated together to bring us in our community some of the most robust diagnostic and sequencing capability of any community in America. So I just want to say thank you to all of you for what you've done, and to stay the course a little bit longer, push us over the line. We're almost there. We're really, really close. And if you haven't been vaccinated yet, please come out and do so. Thank you.
Thanks, everyone. We'll be back next Tuesday.